Greetings, Stanford Tri-Valley Emergency Department nurses. If we haven't had the chance to meet yet, my name is Kristen Klein, and I am your new clinical educator. I've been here since October, working on getting up to speed on things, and now we are ready to launch our annual competency assessment. This year, we're doing things a little bit differently, and this is a pilot model for what the rest of the hospital will try to implement next year. So really excited that we get to be the pilot unit for this project. What we are doing this year for annual competencies, we are not having skills fairs this year. We're not having a skills day. This year, you are going to choose your own adventure. You will get to choose your own skills day. So how this is going to work, attached to this health stream is a smart sheet that you need to go and fill out. You have 2 weeks to do that because the deadline for these competencies is short since we're getting a little bit of a behind start on it. So we need to have a pretty quick turnaround on these assessments. So in the assessment, it's going to ask you to rate your comfortability with what we have decided are core emergency competencies for our department. You're going to rate your comfort with those skills. So 1 means I've never done it before, or I would not be able to do it without assistance. 2 is I've done it before, but I still need assistance. 3 is I can perform the skill independently. 4 means I could teach the skill to others. So for the approximately 24 skills that are listed on this sheet, we want you to rate them all from 1 to 4. The skills that you rate yourself a 1 to 2 on, you will get an email after you submit the smart sheet that will send you the responses that you answered 1 or 2 to. And then what will happen next is you will choose 3 skills from your competency list of your skills that you ranked 1 to 4. Choose 3 of those skills, and that is going to be your personal competency fair for this year. Now, there's some caveats to this, and ways that I will help you guys to get through these competencies. So once you decide on your 3 competencies, I will get a record of what you have chosen, and you will have access to a blank competency form. Now, there are a variety of different ways that you can meet a competency through this education model. It could be through a charge nurse witnessing you performing the skill. It could be going to a class. It could be listening to a lecture or a webinar. It could be even, helping to teach a class, that sort of thing. So there's going to be lots of opportunities for you to decide how you want to meet this competency. So we really want to put it in your hands, so that way the skills that you're learning are skills that you feel are really important to you in your practice. Now, what I'm going to do on my end is look at all of the skills that everybody kind of rated lower on the lower end, and that's going to help me kind of guide what education I need to do for the entire department. So what I have planned for the next 12 months is classes every few months on critical care. So if you want to brush up on your critical care skills, or let's say meet your art line competency, you could come to that class. I'm going to be teaching a triage class, and so if you want to brush up on your triage skills or just learn about assessments, you can come to that class. I'm also opening up the monthly new grad residency and transition to practice classes to anybody who wants to attend those classes. So that would be another opportunity for you to meet some of those competencies that you are required to complete. Now, you will have 6 months to complete these competencies as they're due by the end of the fiscal year. At the end of that time, we will kind of regroup and see how it worked and see if we need to make any new tweaks for fiscal year 26. But from my end, will make sure that I'm giving you lots of opportunities. Every month in the trailer, there is going to be a different kind of skills station set up for your own kind of self-study. So if you want to come check that out, there's art lines in there right now, so you can come play around with those. And then Belmont will be next month, actually the next couple weeks, as we're starting to roll out training. I'm also going to be maintaining an education calendar on SharePoint that is going to include all of the pertinent educational offerings and the links to HealthStream to register for them. So like your BLS, ACLS, PALS courses I'll put on there, the special classes that I'm teaching I'll put on there. I'll put on other relevant classes that are happening in other parts of the hospital or in other parts of the region, just to make you guys aware of the opportunities that are out there so that you can take advantage of them in time to turn your competencies in. Please reach out to me if you have any questions or concerns. You can email me directly, you can text me, you can call me. I'm always available and happy to talk if you have any questions. And I hope that you are looking forward to a new format, a new way of doing competencies, and I'm looking forward to the experiment. Thank you so much for your time, your care, all the hard work that you do to prepare yourself to deliver the best care in Northern California. It's an honor to work with you and beside you and to support you in the care that you deliver to our patients. So thank you very much for all your hard work, and I'm looking forward to helping you meet your competencies.